Everyone, and thank you so much for joining us here at NYHealth Foundation. I'm Julia McCarthy. I'm a senior program officer, and today we'll be talking about the issue of food insecurity for older adults. But before we get started, there's just a few housekeeping items. So first, we'll be recording this webinar, and that recording will be available to you likely tomorrow. They'll be circulated. This and other materials will be circulated afterwards. Video and audio are currently disabled for attendees, but we really invite you to use the chat box to ask questions. You can start putting in questions at any point, and we will either make sure that the speakers see them and answer them in live, or I'll ask them at the end. And finally, we have closed captioning available for those of you who'd like to use that feature, and you can find it within the settings in the top right corner of Zoom. So to start, in New York, we know that more than half of older adults struggle to access the food that they need. Programs like the Supplemental Nutrition Assistance Program, home delivered meals, and congregate meals can really help, but federal budget changes have threatened the integrity of many of these programs. And so to better understand the challenges that older adults were facing, as well as potential policy solutions, NYHealth recently commissioned a study, and we interviewed older adults from across the state. And so today I'm honored to be joined by my colleague Amelia Cobbs and three guests to discuss the findings of this report. So without further ado, I'll turn it to them. We're going to start with a round of self-introductions. So Amelia, I'll pass it to you first, and then we'll go through and start.
Thanks, Julia. Hello, my name is Amelia Cobbs. I'm a member of the policy and research team, and I got to work closely with Julia and other members of the food team on this report, and I'm so excited to get to discuss more about it.
Great, thanks. Valerie, I'll pass it to you to introduce yourself. Oh, and I think you're on mute, Valerie. Sorry.
I have it now. Hello. Hi, everyone. My name is Valerie Washington. I'm a senior citizen, 68 years old, active member of JASA and other senior citizen organizations. And I would like to thank you for inviting me. And if I can give you any positive input, that would be good, and to learn from you. So thank you.
Valerie, we're delighted to have you. Thank you. Macy, I'll pass to you.
Hi everyone, my name is Macy McGowan. I'm the Director of Kitchen Programs at FoodLink in Rochester. Thank you for having me as well. At FoodLink, we have a food bank that distributes 25 million pounds of food each year to pantries that serve senior citizens, a curbside market that brings fresh, affordable produce directly to senior housing and senior centers, a community health programs team that offers nutrition education and benefits navigation to help older adults stretch their food budget. And now recently, thanks to a partnership with Monroe County Office for the Aging, our community kitchen serves over 2,200 meals per week to senior sites in our community.
Amazing. Thanks so much, Macy. And last but not least, Colleen.
Hi, my name is Colleen Heflin. I'm a professor at Syracuse University. And together with my colleague, Madonna Harrington-Meyer, we just released the book, Food for Thought, Understanding Older Adult Food Insecurity. And thank you for inviting me to be part of this discussion.
Thanks to everyone. So Amelia, I think we want to start with you. Let's look at the research. Can you tell us a bit more about the report and what the key findings were?
Let me pull this up. I am going to be giving a brief overview of this pretty intensive report that we're so excited to have published this fall. The title of the report is No One Should Age Hungry, Addressing Food Insecurity Among Older Adults in New York State. So Julia gave a really great background as to the importance of this issue, as well as the current events that are surrounding older adults and food. But some important background is just the importance of food for older adults, particularly nutritious food, both to maintain their health, manage chronic conditions, and but the problem is that there are also different challenges for older adults in facing food insecurity, particularly with having a disability or living in poverty. And we know that older adults are the fastest growing demographic group in New York State. And older adults, New York State has the second in this nation for older adults in poverty at 14.3%. Julia went through various programs that support older adults getting food. Particularly, we'll be looking at SNAP and congregate and home delivered meals. In my overview, we also talk about food pantries in the report. So if you want information about food pantries, I would suggest getting into the report itself. And of course, we have to talk about the recent passing of HR 1 this summer, which is affecting different food programs and other programs for older adults. So we really wanted to get a full picture of the experiences and the evidence base. So we put together both quantitative and qualitative data with the goal of getting this towards different partners in the state, including the policymakers, local advocates, as well as providers and other funders. So we used mostly publicly available data, federal and state level data. One point is very minor, but some groups call older adults 60 and older and some 65 and older. So there is some variability in the data, and just that will be noted in different figures and such in this presentation and the report itself. And of course, we wanted to get that experience of what older adults who face insecurities lives are really like. So we worked to get these interviews with both English and Spanish-speaking food insecure adults across the state, with 40 interviews overall, really to get the demographic and geographic diversity of their experiences. So getting into those food access challenges itself, we know that about 1 in 10, or almost 500,000 older adults across the state experience food insecurity. And that is the gold standard USDA definition. But we know that that is not the same in one part of the state to the other, and we don't have that food insecurity rate at that sub-state level. So we have different measures, including this one on the right, which is older adults without enough food. And you can see that there is such variability in some urban counties, including in New York City, as well as in rural counties in Hudson Valley and in the Finger Lakes. Some older adults, more like 17% or 1 in 6, do not have enough food, which is about double the state average. And Julia also brought up this larger measure, which is difficulty accessing affordable food, which is captures a lot more of older adults. So here we can see over half of older adults are struggling to access affordable quality food, much higher than those who do not have enough food. And you can see that it is pretty widely distributed, both in rural counties in North Country, Western New York, Southern Tier, as well as in certain parts of New York City. I also wanted to include some of the experiences of older adults in this, so I have some quotes. And here on the bottom left, an interviewee talking about how she has to make that decision between the food that she wants, maybe fresh produce, and what she can afford. And as I mentioned, there are, of course, other factors that are affecting food access, such as limited mobility and limited transportation options across the state. And on the right, we have a map of older adults who struggle to live independently. And we can see in some communities, particularly in some zip codes in New York City, over a third of older adults are struggling to live independently, which is double the statewide average, is about 15%. And that measure is really about struggling to with basic tasks such as physical instrumental tasks that would of course affect access to food. And again, this quote of an older adult, she is struggling sometimes to get around, particularly if there's bad weather, and then there's limited public transportation. She has to rely on friends or family to help her get the food that she needs. Then we, of course, wanted to look at these food programs that are so important for older adults. Of course, SNAP is the premier anti-hunger program. Older adults that use SNAP have better health, of course, lower food insecurity, also have lower healthcare costs. And it is currently providing more than or benefits for more than 500,000 households with at least one older adult. However, you can see on the right with this map that the variation in SNAP participation is really widespread across the state, where in more suburban or rural areas, there's much lower participation. But if you look in the big cities of Buffalo, Rochester, Syracuse, New York City, there's much higher participation. And older adults really shared how important these programs are to them to get the food that they need. Here one of our interviewees sharing about like it's an emotional feeling because he would not be able to get the food that he needs. And similarly, we looked at both congregate and home delivered meals. Those are congregate meals delivered on site, like a community center or a church, and then home delivered meals, often known as Meals on Wheels. Millions of meals get served across the state through these programs. However, there are issues with wait lists for home delivered meals. And on the right, we have the top 10 counties with wait lists. They are particularly in more rural regions of the state, like in North Country. And older adults really expressed, again, appreciation of these programs, getting to have that community center and congregate meals, and the effort and friendliness of the workers and home delivered meals. But they do have the problem of not getting accepted when there's a wait list or capacity issues, as described in this quote. So we, again, heard so much appreciation about these food programs, but we also know that a lot of older adults are not enrolling. For instance, more than half of older adults who are eligible for SNAP are not enrolled. And here on the right is a measurement that shows just how many older adults really feel like they could use more information, which is generally more than a third across the state. And it's really, you can see it in both rural and urban areas in the state, where older adults feel that they could use more information about the applicable community services. Some barriers include limited awareness, as shown here, issues with technology, language barriers, different cultural stigmas about being a part of certain programs, also immigration concerns, and also just limited provider service hours. And this quote shares not so much about those, more about like the logistical barriers. Sometimes an older adult might be making a little bit over the income threshold for SNAP. However, they are still struggling to get food on the table. So that was trying to do a short overview of this report that was quite immense, and I think really got to get a big picture. So we did a highlight of the recommendations because the whole recommendation page is about a page and a half. I also have this quote kind of to tie in what I think a big crux of the problem is. The problem is, the difference between what they give you and how expensive life is, how expensive food is. So with that, we recommend the state to advocate to protect SNAP benefits and also continue national data collection on food insecurity. Many of you may know how the USDA announced it would stop its report on food insecurity, which again, that data is the premier information data on food and hunger in the country. It also is how we measure the effectiveness of programs like SNAP. We also think the state has to maintain outreach efforts for SNAP and ensure application and recertification measures are easier for older adults. Currently, the state is a part of the program that helps make SNAP easier for older adults by extending the certification period and waiving recertification interviews for older adults. And we recommend that the state stay a part of this program as long as it is possible. Additionally, thinking about the home delivered meal programs, the state should increase its investment, including through one of the mechanisms, which is the State Wellness and Nutrition or WIN program. And lastly, looking at ways to cover the costs of grocery deliveries for older adults. Older adults who did get that access really appreciated it. Again, even though it might be a couple dollars, it might keep some older adults who are using SNAP from getting groceries delivered. This is particularly important for people who have limited mobility or public transportation options. So if you have any more questions, one, of course, go to the report. Um, I'm excited to discuss more with you all. I want to thank everyone for listening to my presentation. I want to thank Luminos, who was the group that we worked with to get these interviews with older adults. Of course, these interview participants themselves, different partners who gave us a lot of feedback on this work. Of course, my colleagues at the foundation. And please reach out to me. My email is cobbs@nyhealthfoundation.org, and there's, I'm sure, a link to the report in the chat already. And I'll hand it back over to you, Julia. Thank you.
Thanks so much, Amelia. So Valerie, we're going to start with you. We heard from Amelia in the report that older adults across the state are budgeting, are having trouble accessing food because of transportation reasons, or even sometimes foregoing meals. And I'm wondering if what Amelia shared rings true in New York City. What are you hearing here, and does that seem right?
Yes, that does seem right. The most seniors that I want to maintain their independence, and many things obstruct that: the weather, um, um, transportation, and some don't have enough resources, financial resources, and they're not even aware of some of the programs that are out there. That's why it's important to have the information communicated, and that's why it's important that I believe that seniors should. But I found a lot of information by going to the various senior citizen programs and stuff, and the cost of food is crazy. And lastly, as we age and we have our medical appointments and so forth, the doctors do ask us to have more nutritional food, and that may be difficult in some areas, particularly if it's poverty-stricken area, and it's very expensive. So yes, those are some of the challenges. And last but not least, crime. A lot of senior citizens are fearful, particularly I live in New York City, transportation and going out shopping, et cetera, for those who do, are scared of the crime rate. So that also has an impact on them.
Thanks so much, Valerie. When we read the interviews from people across the state, we certainly heard that crime, that they were worried about physical safety, and that was something I hadn't really focused on. I want to ask you one more question about, you said you got a lot of information from the senior centers, and I will say that we were so excited to see when we read through the interviews that older adults giving a lot of credit to New York City, like senior centers. They name specific ones sometimes, like these are fabulous. And I'm wondering if you can just talk a little bit about your experience at senior centers, like what do you do there and how has that been?
Okay, first of all, particularly, I attended JASA. That's the first senior citizen coming out of COVID. I say that saved my life because as seniors, we weren't able to communicate face to face. But going there to the centers, um, you have the staff, the activities that they have. They bring in various speakers to help you understand different services that are out there, not just food shortage, but also your health wise. And I find that very helpful. There are many seniors who don't participate that I know, and they're constantly asking, certain questions or concerns. And I always try to encourage them, hook up or join a senior citizen center, a good one that'll give you adequate information that you may need to help you as we age during this time in our life. Yeah, but it's very important to me. Also, the senior citizen, I got mental health. We have an excellent mental health component coming out of COVID. Also, all the other issues that senior citizens face with their families and health and so forth. And that's very important. And people are, the one I attend, it was initially 3 people. Now we have 47 people or more who attend. It's very important. Um, it's just, you hear their stories. The therapists give you suggestions. We have literature and stuff, and people's experience. It does help other people, particularly when we're dealing with grief and death and things like that, and food and all. But those are so many things. But it's so impactful for seniors, I feel, if they can go out to attend. But also, I said those who can, if they can utilize social media, like you may not physically be able to go there, but if you can access that, you can still participate, even though you cannot physically attend. So yes, I believe it's very helpful.
Yeah, and Valerie, I'll say like we're social beings, humans, and
Mhm.
food is a social activity. And so when
Yeah,
we set out to do this report, we we really wanted to focus on food because that's where we fund. And everyone we talked to, older adults, providers, policy experts said like you can't divorce food from,
right.
from the social aspect and how important that is. So I'm really glad you brought that up.
Yeah, eating alone too. When you're isolated, you don't eat alone. When you go to the counter care, you eat, you communicate to other people. Yeah,
Yeah.
and that's very important.
So I'm gonna switch now to Macy. So Macy, um, as you talked a little bit about in your introduction, FoodLink provides meals through congregate meals to senior centers and among many other programs that you all do. And I'm curious to hear a little bit more about what that experience has been like. That's a newer program for you all, and maybe what some of the challenges are.
Sure. I think for us, the biggest initial challenge was just transitioning to new programming. Our community kitchen has always focused on feeding children and has a deep expertise in child nutrition programs. So for us, it was making sure that we were really aware of the rules and regulations for senior congregate meals. We had to learn new requirements, menus, serving models are different, as well as the audience and logistics. The initial learning curve was significant, but we spent a good amount of time with the previous vendor, which was Goodwill, just kind of learning as much as we could about best practices and to ensure a smooth transition. The dietary needs themselves are a lot more complex than what we were used to, often relating to specific health conditions like diabetes and heart disease, and they require a lot more specifically tailored menus. Meeting those needs while providing food that still really tastes good while staying within budget has been a challenge. And so for us, the focus has always been on scratch cooking, fresh product, fresh fruits and vegetables. And so maintaining our standard within the requirements of these programs can sometimes be a little bit of a balance. Um, for us internally, we had to really ramp up our capacity to take on these sites, especially because they're different than the rest of the sites that we serve. So we spent significant time building out our kitchen space, including prep areas, expediting stations, both cold and dry storage, and additional loading docks for these vehicles. So we have been doing a lot of capital expansion, more equipment, more staffing, more training, things like that. And I think even though we felt prepared to take on the challenge, there have been countless, I'd say, learning opportunities along the way. And so we've just been really leaning into like our partners who are the experts, so Monroe County Office of the Aging, and all of these other people that it's really their wheelhouse. So we're trying to learn as much as possible from them.
Macy, I think it's telling that you started off by talking so much about the rules and regulations rather than the food. And it really, I think, drives home the idea that these are sort of barriers to like, they're really important to make sure that people get what they need and there's consistency across programs, but they're barriers for people trying to do good work to get into this space, right?
Yeah, absolutely. So it's a lot of like starting with what we already knew and coming up with these really solid menus, but then kind of chipping away at it to say, oh, we need a little bit more of that. We can't do this. Okay, this is really expensive, so we have to do something else. But like I said, still maintaining our internal standards of like scratch cooking wherever possible, fresh produce wherever possible, and just providing the most nutritious, best meal that we can.
Thanks. So Colleen, you do research nationally, and I feel like in New York, we're always demanding more. We're saying like this isn't enough, or we need to do more. And I'm wondering like, how does New York stack up? Like, are the experiences that Valerie and Macy talked about, are they sort of consistent across the country? What are you seeing?
Yeah, so absolutely the themes echoed here are found across the country. At the national level, among all households containing adults 60 and over, in 2023, 9.2% were classified as food insecure according to the USDA definition. And when we look at the population that's living below 185% of the poverty line, this rises to 20.5%, one in five older adults. Even with Social Security, We know that many older adults on fixed incomes aren't able to cover all their necessities, and it just doesn't provide much leeway to adapt to things like changes in food prices. We know from medical expenses to phone expenses, we heard in the research for our book how hard it is to stretch a modest fixed income across an entire month. We learned that when older adults do not have enough money to meet all their essential expenses, food often ranks below housing and energy needs, and it competes with medical expenses, transportation, personal and cleaning supplies, and phone and internet coverage. However, we also learned that while financial factors play a large role, non-financial factors also shape the risk of food insecurity in old age, notably poor physical, cognitive, and mental health, lack of access to healthy foods, and the transportation challenges that we've heard about. As everyone knows, SNAP is designed to address the economic roots of food insecurity, and in 2023, nationwide, 9.7% of the US population aged 60 and above participated in SNAP each month. And currently, 1 in 3 SNAP households nationwide contains an older adult. Despite these high numbers, just over half of older adults who are eligible actually receive SNAP, and this is compared with 88% of adults overall and nearly 100% of eligible children. So why is SNAP participation among eligible adults so low? So first, we found that administrative burden associated with signing up and recertifying for SNAP, which is a problem for many, is more likely to be a barrier to participation for older adults and those with disabilities. That is, the process can feel more confusing and more burdensome due to lower levels of education and computer literacy and greater difficulties with transportation, mobility, and sometimes sight, hearing, and cognitive functioning. And secondly, for some older adults, SNAP benefits may be difficult to redeem due to barriers in getting to food retailers that accept the benefits. And the benefit itself may be too low to make a difference. For others, the type of food covered by SNAP, staple items designed to be cooked and eaten at home, may be too heavy to carry, time-consuming to cook, and difficult to adjust to portions suitable for a person living alone. And most older adults on SNAP are single adult households. While SNAP is designed to be the way of addressing economic roots of food insecurity, it falls to the community-based programs to address the problems related to physical health, mental health, access to nutritious food, and transportation. And here I'm talking about the congregate meal programs, home delivered meals, and food pantries. In our research, we found there were 2 issues with these community-based programs that were barriers for older adults. First, the quantity and the quality of food, both meals and groceries, varied markedly by where one lived. And the food available was sometimes of poor nutritional quality, as reported to us by the older adults we interviewed. And given that much of community-based food sources often rely upon volunteers and donations, and sometimes food waste, maybe this shouldn't be a surprise. You get what you pay for. And as Macy's told us, right, nutritious food is expensive. Secondly, physical, cognitive, and transportation limitations associated with being older often are a barrier to transportation themselves, even for services focused on older adults. Many food banks or congregate meal programs, particularly in rural areas, are only open for short windows of time, and that can be hard for older adults to get to. And often small fees are associated with Meals on Wheels and congregate dining. And our respondents described these as barriers to participation among our respondents as well.
I mean, I want to say, Colleen, the point about like, I love those details about how it's not just money, it's so many things compounded. And I want to share a brief story if I may, because people took the time to really tell us how it was and in these interviews. And there was one man, for example, who was in a wheelchair and had to go shopping multiple times a day in New York, or multiple times a week in New York City because he couldn't carry all the groceries he needed for himself and his son, who he was caring for, who was an adult. And so he would strap them to the back of the the back of the wheelchair to get them home and put one on his lap. When he got home, the height of the counter was actually like quite difficult for him to then prepare the food on. And so details like that that you really don't think about if you haven't had those mobility issues, or if you haven't thought about how tight the aisles are in the grocery stores. He described that he couldn't get anything above waist height because he couldn't reach it, right? And he had to pick certain days to go grocery shopping because they'd be too busy and it would be dangerous for him. And so I think those details are just really put a human element to that. So I want to just add even more color to what you were saying. So thank you. But I don't want to dwell on, we don't want to just admire the problem, right? Like, let's talk a little bit about solutions. So Valerie, I want to start with you by saying, like, what are some of the changes you would like to see that would help older adults get the food that they need?
Um, feel comfortable when they participate in congregate care. Um, it's it's a safety issue. Um, some talk about, and also the weather, you know, is a challenge. There's so many other issues, and even if you're not participating in congregate care, um, how do you deal with paying for these items because inflation, and so forth, and lack of income, particularly in poverty-stricken areas. Um, uh, um, uh, um, um, there are other programs too to let them know about for those who are able to use social media, like ordering food online if they understand how to do that. And I, it's just very complicated, I find, and very sad and very challenging for seniors.
Yeah.
I call it the lost, the lost tweens or whatever generation, um, and just that hopefully um, more information will be provided for the seniors, even the ones that aren't able to come out and the use of social media is very important. That's what we find in that as we're learning how to use it. Um,
Yeah, and I think Valerie, that's something like when we had done a survey on food insecurity 4 years ago. And even at that time, the reason we went back to do this research is because we didn't get enough older adults participating in that. And I think we're starting to see such a shift in how older adults engage with technology, and hopefully that will unlock more, um, access to programs. And still, I think we need in-person contact too, right? And like face-to-face interaction. So I think, your point about social media, we should be thinking about how better to use that, how to do more outreach, and how to make sure people are connected to the services they want. So Macy, I'm actually going to put the same question to you. As a provider, what kind of changes would you like to see that would make your job a little bit easier serving older adults?
I mean, the funding is always the big one, both internally and externally. Externally, now that we have a really solid foundation built, we do have the ability to serve more sites in the future, but more sites would need to have funding to support sustainable programming. And we're seeing that already. Folks are hearing that we have this program and how can they partner with us? But a lot of sites don't have the funding to sustain a meal program, especially if they're already focusing on other resources and things like that. Internally, funding is also crucial, not just for the food and equipment, but for the administrative staff who are critical to running these programs that aren't covered by our contract with the county. And so we're incredibly grateful for organizations like NYHealth Foundation for supporting our work and helping ensure that this program remains impactful and responsive to the seniors that we serve. But we are looking for opportunities to partner in other ways too and expand some of these services, hopefully if able.
Great, thank you. So in the same order again, Colleen, are there policy solutions that can help address some of the discrete needs that Macy and Valerie talked about?
Sure. I have a little bit of a laundry list. So I think at the local level, I recommend thinking about transportation funding, um, uh, and trying to direct that in ways to make sure that there are sidewalks that are accessible to grocery stores and that those are cleared of snow and ice. This is something we've been working on in Syracuse. I'm really excited. as well as thinking about increased funding to support more bus routes to go to large grocery stores from senior housing potentially. I encourage food banks to consider home delivery options if they don't have one, and for congregate meal sites to make sure they're providing transportation assistance. We learned in our interviews that a lot of that went away after COVID, and those services don't seem to be available as much, at least according to our respondents. And we know Meals on Wheels in many areas have the waiting list that we saw. And so we need to figure out how to get better support for services in our community. Moving up a level, given federal changes, we know that there are new work requirements for SNAP that are going to be a significant source of confusion and concern for those 55 to 64. So community groups can help this population understand what's needed to meet the 80-hour-a-month work requirement. And this might include creating some volunteer opportunities and maybe some that can be done from home. So I encourage some creative thinking there. At the state level, I also encourage New York State to adopt the standard medical deduction, as well as to request the recertification interview of elderly and disabled households waiver. Both of these provisions reduce the administrative burden placed on older adults to receive SNAP, and they can actually receive more benefits with a standard medical deduction, but it also will reduce the administrative cost for the state. And this will be important because the state's going to be bearing a larger portion of those costs beginning in October 26th. And finally, here in New York, in some areas, older adults have the ability to use SNAP funds at participating restaurants, but we need broader participation in the restaurants that are participating in this program, so it's more than fast food. In this area, the last time I checked, it was Kentucky Fried Chicken was the sole restaurant. And I'd love to see healthy options added to the restaurant meal program provision.
Great. Thanks so much, Colleen. I think, one of the things that, just circling back to where we started on like the federal reconciliation bill that passed this summer is going to make vast changes to SNAP. And I'm talking about SNAP because we know that it is the best way to connect people to food, assuming they qualify. And I think there's going to be a real tension and something we all are going to have to think a lot about, like when the state will be on the hook for covering more of the benefits based on what's called the SNAP error rate. And I think research shows, correct me if I'm wrong, that when you extend recertification times and make sort of more flexibility, that sometimes that can work in tension, and it can be in friction with sort of error rates. And so figuring out how we keep the most possible people on the program without incurring additional cost. I don't know. I see you dubious, so please tell me.
Well, some of the waivers actually change the definition of what an error is. And so that can actually work to reduce the error rate. So and New York has most of those, but the standard medical deduction would help, would add another one actually.
Yeah, and to be clear, we're still in our own report advocating for those changes, like extending research, including the medical deduction. But okay, I'm going to turn to there are so many great questions in the chat, and before I start asking them, I want to just say very explicitly, NYHealth commissioned this research because we really care about this issue and we want to be investing more in food insecurity around older adults, and whether that's testing something new, trying something new, piloting, or working on policy solutions, we are interested. And so, we hope this is the beginning of a longer conversation and a way to engage on so many of these issues that are showing up in the chat. So I want to be clear with that. I'm going to start sort of with some of the questions in the order they came, and then I'll pop around a little bit. So one of the first questions, Valerie, this was for you. It said, would it make more sense to put food pantries at senior centers, and our church is still a gathering place for older adults in your area? They know that the winter makes this hard.
Yes, that's a good solution. Yeah, for those who are able to go, but it's also important for the ones who can't make it there, that they have their meals or find delivered to them.
Mm-hmm.
But I think that would be helpful.
Great. I think a lot of questions came up, and this is for everyone, so please, feel free to respond, chime in, around transportation in rural areas. What are some of the, um, you know, issues you hear about? And then also, do you have ideas about like how the state could step in or counties could step in to help solve that problem?
Are you asking me?
No, this is for
Oh.
everyone. So this is open to whomever wants to. I mean, maybe not for you, Valerie, just because you're in an urban area,
I'm
but
in an urban
if
area.
you have ideas about rural areas, feel free to share them.
I mean, if you're in a rural area, if there are days in which transportation services can be provided for those who want to participate in programs there. You may have like 2 days out of the week, a specific time, um, and particularly transportation because everything is so. Um, uh, did the area? I'm trying to remember. Yeah, and other things, but I think the transportation issues and getting the information in rural areas would be very helpful. And that's why I believe social media is very important. And for us seniors, it's, to continue to learn how to utilize that will help us in this day and
Yeah,
age.
I will share. I mean, we hear this concern all the time. One of our grantees, the Rural Health Network of South Central New York, has been trying to, figure out a solution to this problem for years, and has tried to figure out if there's ways to, you know, link access to medical care to grocery store shopping. Have also been thinking about, whether they could cover the delivery costs of groceries, which was one of the recommendations in our report. And yet the grocery delivery services won't come out to the most rural areas and the places where this service is needed the most. And so, we're hearing closer to New York City that those delivery options are expanding even to sort of suburban and more rural areas in a way that they weren't before. So it's a money problem, not a transportation problem solely. Like, can we just cover the cost of transportation? But um, I think we're all still a little stuck on how you reach people when the grocery providers won't actually service those areas. Colleen?
I think one thing to think about is how to group services together. So, I know in like um, some uh, other countries, grocery stores are really the center of many services. There's the post office. There's the, um, definitely a pharmacy, maybe some quick urgent care clinics. Um, Library services. So really trying to think about how to co-locate, whether it's food pantries or I know try to just make sure that things are happening on the same day. So if somebody is managing to get a ride, that they can get everything done in one trip because they may not be able to get two rides that week, right? And so
Mhm.
I think trying to simplify things so things are closer together um, and more just closer. I think we tend to separate everything, and I think we need to pull them back together in our rural areas to make it more feasible.
Think to on that note, there's a question talking about how siloed older adult programs are. So this person said, how do we work to ensure that congregate and home delivered food programs are understood as part of the state's broader anti-hunger infrastructure? So, they're siloed under aging programs, and it says, for example, providers who deliver groceries directly to an older adult's home are not eligible for funding through the state's HIPNAP or Nourish New York programs. And I think one of the things we certainly have found is that um, many of the advocacy groups that think about food insecurity issues don't necessarily have experience working with older adults or that perspective. And I'm curious to all of you, are there ways that you see that could expand so that there's sort of like um, greater integration of older adult issues with food security issues?
so partly I'll just say that I think it's as there are more older adults that they comprise a larger portion of the population, it's naturally going to, over time, going to become a larger issue. As there are fewer children and more older adults, we're going to be shifting our attention to older adults, and our services are going to follow that. Um, I think I think we just at this point need to be talking about this more and explaining how the issues are a little bit different for older adults. And that to me may mean there needs to be some different approaches. And I'm not sure the same approaches are going to work as that work for other ages for older adults. And so I would still like to see some specialization for this age group. While still understanding that some of there's a lot of commonalities there as well.
I would just like to also add that, I know Julia's often mentioned how like to think about food as an intergenerational issue where there are households with children and older adults and food is getting shared together and thinking how it can be supporting people across the lifespan. And that would be the ideal way to start thinking about food policy in our state.
Great. And there are still like many comments that I'm trying to keep up with in the chat, some in response to each other, and that's exactly what we're hoping for and to get more ideas about sort of like ways to collaborate. This one I think, Macy, maybe for you. So there were a couple people who run farms who were asking, if we are producers of high quality, fresh fruit and vegetables and we want to serve this population, is there a way to better partner with nonprofits? Like they didn't explicitly say FoodLink, but given that you do some scratch cooking, like, is it possible? Is it difficult because of contracting or cost? Or talk us through that, please.
Yeah, it's definitely possible. I think in our case, we partner as locally as we can, but a lot of the issues that we need so much food. So sometimes those opportunities are limited. Um, and because of just like the cycle of the menu, we need specific things in high volume at specific times, and then other things we just might not need very often. So I'd say in our region, it may be better to partner with like the specific agencies or other kitchens that are cooking their own food, as opposed to a place like us where we're providing the food already kind of ready to go.
So maybe finding like a smaller provider at the same size of you and working at that level. I'd say another thing that's possible is linking up with the local food hub. I'm sure farmers have explored this, but for instance, we have a grantee that helps run a food hub in your county up near Rochester, and so aggregating food and then having the hub actually compete for contracts or work with those larger suppliers may be another way to participate if you're a producer. More questions. So, this is another one. Are there special services in place to address poor nutrition and health disparities among older adults in historically disadvantaged communities, especially where there's unemployed, low-income older adults or their families? I will say that just to kick this off, that obviously SNAP is available to everyone, but if there are tailored you know, programs focusing on food and nutrition for older adults. New York State, unlike most states, I believe, has a requirement that there be nutrition education classes at any senior sites that are offering food, and there's a certain amount of classes that must be required, and so I think those are critical potential resources there. There are also some resources through Medicaid that are made available that I think people are talking about a little bit in the chat. But I don't believe that there's, to someone's earlier question, like as many resources directed at like targeted resources directed at specific communities for older adults when it comes to food. And then Colleen, maybe this question's for you. Amelia, you can chime in too. There were serious gaps in sort of participation for SNAP eligibility? And for older adults specifically, are there any social or cultural shaming factors that come into play for people participating?
Um, so I think sure. First, yeah, I'll say absolutely. I think for some older adults who maybe have struggled their entire lives, they may be familiar with SNAP. But for many older adults, there's really a change that happens around retirement, and maybe there's a health situation that forces them to retire early. And so they're not really aware of the safety net options. And there is stigma and shame. And sometimes a sense that if they receive the benefit, they're taking it from someone else, that it's a zero-sum game here. And so I think we've always been able to feed ourselves at this point later in life. It can be very shameful internally to have to require that help. So definitely. And then the fact that the process can feel so intrusive to have to, all the questions that are asked about who do you live with and how much money do you make and show me your checking account. And right, they're not taking people's word for it. It can feel like a very huge loss of privacy, which, um, you know, some of us, I think the younger generation is used to just sort of giving all this information out, but for older adults, this can be feel very risky as well as just nosy. Um, and so I think these are real barriers for older adults going through the process.
Amelia, I see you off mute. Do you have
Yeah,
anything you wanted to
yeah.
add?
These are definitely a lot of themes that come up in interviews with the older adults on our report. A lot about feeling that maybe they were not in need enough for certain programs or old enough. And they didn't see themselves as the group that would be going and getting these services. Also feeling um, maybe stigma with using an EBT card, all these different things. And also this idea of like not expecting themselves at this age to be a part of it. Maybe they were, some people talk about working in social work related things. I'm feeling like it would be strange to be coming to this place where near once I once worked at, or people, yeah, I think there's like a, whether or not you're identified with that can be difficult. And instead of, I think one of the things we want to talk about is thinking about these places as a place of community rather than, oh, whether or not I'm needy. um, and also, yes, I think people who maybe have experienced, I know that one of the biggest predictors for being on SNAP as an older adult is if you were on SNAP previously. So I think that is definitely a big factor about what your working life was like before you became an older adult.
Thanks so much. I want to just really emphasize 2 points made there. So one, or 2 points that we haven't quite covered, but this conversation is making me think about. First is the issue of skimming. So having benefits stolen from cards at the point of sale. And this is a huge problem in New York State, and one that we hope that the governor will take up in the state of the state to address this issue. But we heard from so many older adults when we were doing this research that they had had benefits stolen and they weren't able to recover them. And so this had undermined sort of their trust in the program. And so, just saying that this is a huge problem and it especially affects older adults. The other one that I really want to drive home is sort of the intersection of immigration and older adults. So we heard themes when we were reading this so many times about like, I have come here to this country and I have worked for decades and I have paid into the system, and yet I'm being made to feel like I then can't participate in SNAP or participate in these other programs as an older adult. And how upset and angry people rightfully felt. People also really expressed fear about accessing these programs in the current administration. And as a state with one of the highest percentage of immigrants in the country, this is something that like we have to be very seriously thinking about, sort of this intersection. I mean, really just heartbreaking comments about people being afraid to leave their house, being worried about using a program and then upending accessing that program and the information provided, then like undermining the life that they have spent decades building. And so that is something that I think we will need to continue to think about here in New York. I realize we are at time, so I want to first just give, if anyone has any last parting thoughts or things they wanted to say that they didn't get to say, pause for a second for that. All right. Well, without more to say, I want to say, Macy, Colleen, Amelia, and Valerie, thank you so much for this discussion. It's been so helpful, and we hope it really is the first of many about how we can start to rethink addressing food insecurity for older adults. I'd like to just, remind you that these slides and everything will be shared later, and we really appreciate you joining. I'll put the report link here, and you can stay connected to us through New York Health. But again, thank you so much for joining us all today, and thank you to the speakers.
Thank you.
Thank you.
Thanks for hosting the conversation, Julia.